allergy is defined as an abnormal reaction of the body to a normally harmless substance. So both are important. The body reacts abnormally. The second is to a normally harmless substance. So all of us react, all our bodies react adversely to poison. That is not allergy to a normally harmless substance. So most of the people do not react to a particular substance, but some of us are allergic to that. Some of us react adversely to it. That is allergy. Commonly seen with peanuts. Most of us take peanuts and are quite okay with it. But some of us develop vomiting or stomachache following taking peanuts. This is called allergy. Now, this allergy may manifest in different organs of the body. It may manifest in the gastrointestinal tract or the digestive system. It may manifest in the skin, in the eyes, or in the nose. So when this allergy manifests in the nose and has symptoms associated with the nose, then we call it allergic rhinitis. The term rhino is the Latin for nose. And inflammation of the nose is called rhinitis. It comes from the term rhino, inflammation, itis, so rhinitis. Rhinitis of allergic origin is called allergic rhinitis. Exposure to the substances to which your body reacts abnormally, that's the cause. Exposure of what kind of substances? Since it's the nose, only exposure to inhalant substances, only the substances which you can inhale can cause allergic rhinitis because they have to come in contact with the nasal lining, the nasal mucosa. So inhalant allergens will cause allergic rhinitis. Multiple episodes of sneezes, multiple sneezes in one go, 15, 20 sneezes together, one after the other. Blockage of the nose and runny nose. Out of these 4 symptoms, at least 2 have to be present for us to call it rhinitis. And if there is an associated history of the triggering factors that once I'm exposed to dust, I develop these symptoms. When I'm exposed to automobile smoke, automobile exhaust, then I develop these symptoms. Then if there is a history of a certain triggering factor, then we call it allergic rhinitis. Allergic rhinitis, for all practical purposes, cannot be cured. It can only be treated. That means that as long as the patient is on treatment, the symptoms will be controlled. But once the patient goes off treatment, then the symptoms come back. All allergies are like that. So the treatment is in the form of antihistamine tablets or in the form of inhaled nasal steroids. These are the mainstays of treatment. There are other options too. And then there is a preventive aspect where you reduce the exposure to the triggering substance, to the allergen, to the substance which causes the allergy. Now, this sounds good in theory, but in practice, it is very difficult. As I said earlier, that the commonest allergen is dust and pollen. How do you reduce your exposure to dust and pollen? The only way that you can do that is if you lock yourself up in your room and don't go out. Is that possible? Is that practically not possible? You have to go out, you have to work, you have to leave your house, you have to go to the shops, you go to the market. So you cannot risk your life. That next is, if you wear a mask. Yes, you can wear a mask. But if you wear a mask, you can reduce the allergen exposure by about 70 to 80%. Thing is that the remaining 10 to 20% or 30% is good enough to trigger off an allergic response. So it is very difficult for nasal allergies. For food allergies, yes, you can avoid a particular kind of food and totally stay away from that kind of an allergic reaction. But for nasal allergies, it's very, very difficult to avoid allergen exposure. So the mainstay of treatment is actually, if the symptoms are intermittent, then we give antihistamine tablets. And if the symptoms are persistent, then we give them steroid nasal sprays. There is nowhere that you can prevent allergic rhinitis. If your body reacts adversely to a particular substance, then your body is like that. There's nothing that you can do to prevent allergic rhinitis. There is something which is called the hygiene hypothesis. Now, that's a very interesting theory. I'll tell you what the hygiene hypothesis is. Now, it was observed in various studies that children who grew up in rural and less sanitary environments had a lower incidence of allergies in adulthood compared to children who grew up in urban centers and in more hygienic surroundings. So what does it mean? It means that those who have been exposed to dust and other unhygienic conditions in childhood, they have a lesser chance of developing allergy than those who have been brought up in very sterile and hygienic environments. So what does it mean? Let your children play in the dust. Let them get dirty. Don't try to stop it, because in the long run, it will help them. Second is very important for us doctors to know that early antibiotic therapy, in case of most diseases, in case of respiratory infections, increases the chances of the patient developing, the child developing allergy later on. Why? Because early exposure to repeated exposure to infections triggers of the immune or makes the immune response react in such a way that allergies, there are fewer allergies develop later on. Whereas early exposure to antibiotics, when you cut off exposure to germs or infective agents through early treatment with antibiotics, then the chances, the immune system reacts very differently, and the chances of developing allergic conditions later on in life increases. So how do you prevent? In a gist is avoid early antibiotic therapy or overuse of antibiotics in children first. Second is, if your child plays in the dust, child plays in the dirt, let him play, let him enjoy, let her enjoy, and don't be too overbearing on them and try to drag them away and bring them up in too sterilized and hygienic environments.